Well, I'm not going to go and give the whole lecture on the spectrophotometer because you can watch it by just clicking on this, and it's about a half-hour length. Let me just give you some basic concepts that I'm going to develop further today. So on the spectrophotometer handout, let me just make the following couple of points. You know, we've all had blood drawn from us. In fact, we may have had blood tests, and we may have had urine analysis tests. Has anybody done that? All right. And then what they do is they measure the concentration of chemicals in our blood and in our urine. And they from that, they determine the sugar level in your blood, the cholesterol level in your blood, the protein level in your blood, the electrolyte levels like the sodium and potassium. You don't have to copy any of this because it's all, you're going to watch that half-hour video and I walk through the whole thing. I'm not going to do that today. All right. So the question is, when they determine, they sent that sample of blood to the quote clinical lab, or that sample of urine to the clinical lab, how do they determine the concentration of sugar in your blood, or cholesterol in your blood, or protein level in your blood, or electrolyte levels in the blood? And the answer is it's all based on this concept of using a spectrophotometer. Now, when you watch the video, you'll see me explain the relationship known as Beer's law, which basically shows that there is a linear relationship, a straight line relationship, between the amount of light absorbed by a solution and the concentration of that chemical in the solution. Now you might say, what does that mean? Well, mostly you're going to watch that video to find out, but let's just show you this way. On page 2, let me just put it this way. If you had just a test tube filled with water, just a test tube filled with water, all right, and the light goes through that test tube, all right? Now, what if there's sugar in the water? If there's sugar in the water, how do you think that would affect the amount of light that goes through that test tube? It would less. There would be less light going through the test tube, or another way of saying that is some of that light is being absorbed by the sugar. That's the concept of the spectrophotometer. That basically, the way this device works is it's a light meter. And it simply measures the amount of light either going through the tube, that's called percent transmittance of light, or the amount of light absorbed by the solution. And so Beer's law basically says that the more solute there is in that solution, the more light it absorbs. So there is a linear or straight line relationship between the amount of light that a solution absorbs and the concentration of the solute in that solution. So this is really the whole principle of how they use a spectrophotometer to determine the sugar levels, the cholesterol levels, and so on. Now, if you, again, you're going to watch the video, but just look at page 4 of this handout. So the way they actually do the spectrophotometer, the way you used it in chemistry and in microbiology and in physiology, which is what we're doing right now, is in order to determine the concentration of sugar or cholesterol in a blood sample, in a sample of blood, we first actually have to establish what is the relationship between light absorbance and the concentration of that sugar or cholesterol in these solutions. So what they do is they actually prepare what are called known solutions. So in this example on page 4, imagine we prepared a 30 milligrams percent glucose solution. Now you should understand what the unit milligram percent means. It means milligrams per 100 milliliters. So if we put 30 milligrams of glucose in 100 milliliters of water, that's a 30 milligrams percent glucose solution. And we would measure how much light it absorbs. How much light it absorbs by simply putting it in a spectrophotometer, and that tells us light absorbance. It's like a light meter. All right, then we would do that for a 50 milligrams percent glucose solution. Obviously, it absorbs more light. And a 60 milligrams percent, and a 70 milligrams percent. And each of these absorbs more and more light. And, all right, now, we then take this data and graph it. And that's what you're going to be doing. You're going to be graphing. All right, so here it just shows that literally using the data from above, we constructed a graph showing light absorbance versus concentration. So just as an example, the very first set of data points were, if you have a 30 milligrams percent glucose solution, it absorbs 0.25 light. Now there are no units in light absorbance. It's simply just a numerical value. So if you look on the graph, you find on the concentration, the x-axis where concentration is, you find 25. All right, that's, let's see, about here. I'm sorry, was that 25 is actually, oh, it's 30, sorry. The 30 milligrams percent, and it says it has a light absorbance of 0.25. Can everybody see the data point? All right, and then the next solution was, what, 50 milligrams percent and a 0.38. So we come over here to 50, and we put a data point right here where it's about, what did I say, 0.38, right? Pretty close to 0.4, all right? So then we put these data points using this data here, and we draw a line that best fits those points. This is showing the linear relationship between the amount of sugar in a solution and the amount of light it absorbs. Now that we've constructed this known graph, we now can take an unknown solution. You'd say, what do you mean? So on the next page, on page 5, it says, imagine if we had an unknown, let's say it's a blood sample, and we measured its light absorbance for glucose, and we got a light absorbance of 0.35. So all we do is we go to that graph we've just constructed, find 0.35 on the graph, drop a perpendicular down, and estimate that the concentration of sugar in this unknown solution is 44 milligrams percent. All right? Now, again, and for our purposes, we're just estimating. All right? I don't care if you say 40 or 45, but it's somewhere around there as far as estimating the amount of sugar in that solution based upon the amount of light it absorbed. So everybody follow? We first have to construct a graph, and then once we have established this linear relationship between the concentration of a chemical and the amount of light it absorbs, then we can determine the concentration of any unknown solution just by measuring its light absorbance. All right, so that's basically the whole concept of spectrophotometry and Beer's law. Now with that in mind, let's take a look at this other handout we gave you, the clinical use of atorvastatin. Now what I tried to do, in any physiology class that you would take, no matter which teacher you'd have, they'd probably do a lab exercise with the spectrophotometer, just like you use it in chemistry classes and microbiology classes. What I tried to do, though, is to make this extremely clinically relevant, as you're going to see. So let's just kind of walk our way through this handout. Again, you're going to watch that spectrophotometer video, which is about a half hour, and walk your way through and make sure you understand the principles of spectrophotometry and this relationship between light absorbance and concentration of a chemical in solution. Now, I'm using the example of atorvastatin. Atorvastatin is the generic name for Lipitor. Lipitor is the #1 most prescribed drug in the United States. So whatever we learn about it, we're talking about not some esoteric drug. We are talking about a medication that more people basically take every single day than any other medication. Now, what is it used for? First of all, I might just tell you that atorvastatin belongs to a class of drugs commonly called the statins, because all the generic names of the drugs in this class have the ending statin. Anyhow, all of these drugs are used in the treatment of atherosclerosis. Atherosclerosis, we know, is the buildup of fat and cholesterol in the inner walls of our arteries. It is the leading cause of death. As we will learn more further in this course, as the fat accumulates on the walls of our arteries, that's what increases our risk of a heart attack or a stroke. And the #1 cause of death in this country is heart attack, and the #3 cause of death in this country is strokes. If you're wondering what's the #2 cause, it's cancer. all right? But the number 1 and 3 cause together are both due to the buildup of fat on the walls of the arteries. That's why so many people are taking this medication. Now, fat builds up on the inner walls of all of our arteries. But you know, you don't necessarily die if there's fat buildup on the walls of your arteries in your legs. Where you can die is when you get a buildup of fat on the walls of the coronary arteries that supply oxygenated blood to your heart, or they build up, fat builds up in the, let's say, the carotid arteries that carry oxygenated blood to your brain. Because the heart and brain, if they don't get enough oxygenated blood, they die. All right, so that when you specifically have the buildup of atherosclerosis in the coronary artery, it's commonly known as coronary artery disease or coronary atherosclerosis. All of this is related to simply having elevated levels of cholesterol level in your blood, called hypercholesterolemia. What does emia mean? In the blood. So hyper means high, cholesterol means cholesterol, and emia means in the blood. The way that all the statin drugs work is they actually are enzyme inhibitors. We actually learned that back in Section A. They actually inhibit an enzyme. I'm not asking you to know the name of it, but it's called HMG coenzyme A glucuroreductase. And this is an enzyme in our liver cells. And this enzyme actually converts saturated fats into cholesterol. So by inhibiting this enzyme, it prevents your liver from forming cholesterol from the saturated fats that you eat. Even if you're able to really eliminate, and it's almost impossible to eliminate, but even if you're able to eliminate all the cholesterol in your food, it's impossible to eliminate saturated fats. Because there's saturated fats even in plant products. Not a lot, but there are plenty of saturated fats even in plant oils and so on, vegetable oils. And incidentally, in order to eliminate all cholesterol, you'd have to cut out anything from an animal. You'd have to basically go vegan, all right, to eliminate all cholesterol. But even if you did that, there's still saturated fats in plant products, even if you're a vegan. So remember, we're not trying to lower cholesterol levels if your cholesterol level is within the normal range. We're only trying to lower it if it exceeds the normal range, that you have hypercholesterolemia. Now, we wrote that in this exercise, which you're going to be working on, including making graphs, you're going to evaluate data collected from a hypothetical patient taking Lipitor for the management of his hypercholesterolemia. Now, let me just stop here for a moment and speak a little bit about the word management. I don't know how much you appreciate this, but medicine can cure very, very few things. Among the few things that medicine can cure are infections. If you have a strep throat, which is a Streptococcus pyogenes infection of your throat, then you can be prescribed amoxicillin for 7 to 10 days. That amoxicillin, we know these antibiotics are bacterial enzyme inhibitors that cause the bacteria to die. That destroys the bacterial infection and you are cured. All right, until the next time you get it. All right, so that's a cure. We can do that. Another thing that doctors can cure is if somebody has a benign tumor, not a malignant tumor, but a benign tumor, a growth, they can surgically remove that growth, and at least for the moment, you're cured. The growth or tumor may return, and in fact, it may even come back malignant, but at least for the moment, it's gone. That's about it. That's about all that medicine can cure. Almost all other medical problems, all that medicine can do is to manage and control the problem, prevent it from getting worse. It cannot cure it. Let me give you some examples. Is there a cure for asthma? No. People who have chronic asthma will take medication to control their asthma, to reduce their symptoms of having difficulty breathing every single day for the rest of their life. All right? I do myself. I take Advair every single day. All right? Is there a cure for diabetes? No. People who have diabetes will take medication every day for the rest of their life to control their diabetes so it doesn't get worse. Is there a cure for high blood pressure? There's no cure for high blood pressure. People, once you're diagnosed as having high blood pressure, will take medication every day for the rest of your life to control it and prevent it from getting worse. Is there a cure for epilepsy? There's no cure. You'll take medication every day for the rest of your life to control it. Is there a cure for biochemical or neurochemical depression? No. You'll take medication every day for the rest of your life to control your neurochemical depression. All right? So there is not a cure for these things. They are treated. How about arthritis? Is there a cure? No. You take medication every day for the rest of your life to control your arthritis. So most of medicine is managing a problem. Now this also explains another issue. I said that Lipitor is the #1 most prescribed drug in the United States. Wouldn't you think that they would sell more amoxicillin every year than Lipitor? Why do you think that they actually sell, and they do, they sell more Lipitor every year, Lipitor pills, than amoxicillin? I mean, clearly there's got to be more people who get sick and take antibiotics like amoxicillin.
Take this every day.
Right, that's right. If you're sick and you have strep throat or they prescribe you amoxicillin, you take it for 7 to 10 days. You're done. If you have that, so even if you had 100 people who are prescribed amoxicillin, each one's only taking enough pills for 7 to 10 days. If you've got one person who needs Lipitor, they take 365 pills a year. One every single day. So they sell a lot more pills for these chronic problems that can only be managed rather than cured. So that's why the most prescribed medications are medications for chronic problems for which there's not a cure, not for antibiotics. So they don't actually make as much money on selling and developing antibiotics and selling them as they do for medications that you take every day. All right, now, another thing related to this. When a doctor prescribes amoxicillin when you're sick, do they tell you do they usually tell you, come back next week, I want to check you out? They usually don't. They just give you the amoxicillin and that's it. If it doesn't work, then you'll be back. But in all probability, if they have correctly diagnosed the problem and they've given you the correct medication, it's solved. So if you're only going to take a medication for 7 to 10 days, we don't really have to worry about any adverse effects or side effects created by a medication you only take for a week. But if you're going to take a medication every day for the rest of your life, they want to see you every few months to make sure that you're taking the right amount. Maybe they need to adjust the dosage up or down, and they need to see if that medication is having any harmful or adverse effects. Do you have a question? Okay, that's okay. If it having any side effects. So that's why we wrote, in this hypothetical patient, you're going to track their cholesterol level over a 10-week period. And since every therapeutic drug also produces side effects called adverse reactions, you will also be monitoring for possible injury caused by the drug. Now, in the third paragraph, you're going to learn something that I'm sure most of you have never heard of, and it's very, very important. Whenever tissues are injured for any reason, they release or leak enzymes from those injured cells. So we wrote that injury to tissues is often monitored by measuring the level of certain enzymes in the blood. You see, different cells in our body contain different types and amounts of enzymes. The muscle cells contain different enzymes needed for muscle chemical reactions than do brain cells, which have other enzymes needed for chemical reactions occurring in brain cells. So when these tissue cells are injured, the enzymes leak out of the cells into the bloodstream, raising these enzyme levels in the blood. The greater the injury, the higher the plasma enzyme levels become. Therefore, elevated levels of certain enzymes in the bloodstream would indicate which tissues have been injured and to what extent. Let's show you what we mean. Look on the next page, page 2. So on page 2, it lists a number of enzymes, and doctors monitor these enzymes all the time. These are what blood tests are about. And I want to focus our attention on the 2 that we put in bold print. There's an enzyme called creatine phosphokinase, abbreviated CPK. This enzyme is found only in muscle tissue, only in muscle cells. Now, it is found in all muscle cells. It's found in skeletal muscle, heart muscle, visceral smooth muscle. Now, you'll notice that right here it tells us what the normal level of this CPK enzyme level is in the blood. What do you notice about the difference between males and females in the amount of this enzyme in their blood? A little bit higher in men. Why do you think that is? They got more muscle tissue, so they got a little bit higher level of this CPK enzyme level. Now, we just told you that anything that injures muscles, for any reason, the injured cells will start to leak these chemicals because the cells have been injured and they may be damaged. The enzymes start leaking out of the cells. Some of it enters the bloodstream, and these levels in the blood may start to rise. So if the doctors measure, if they detect, when they run these blood tests, elevated levels of CPK, they know that there is injury to muscle in the body. Now, they actually can differentiate whether it's skeletal muscle or heart muscle, because there's slightly different forms of this enzyme in the heart muscle cells than in skeletal muscle. They don't necessarily know what's injuring the muscle, but they know the muscle is being injured. In fact, they actually monitor CPK enzyme levels when people have a heart attack. Has anybody ever heard of that? So this is, you've heard about this, that this is one of the important enzymes. There's a few of them that they monitor, including LDH. And these are enzymes that leak out of the damaged heart muscle when somebody has a myocardial infarction or heart attack. It would also, the CPK levels, enzyme levels rise if somebody has injury to skeletal muscle. It may be due to trauma. It may be due to an infection. It might even be due to taking a medication, if a side effect of the medication is damaging the muscle. Now, another example that we put in bold print is Alanine Aminotransferase, or ALT. The older name for this enzyme was glutamic pyruvate transaminase, but they've now changed the name. This enzyme is found only in liver cells. Only liver cells contain this enzyme. This is the normal value of this enzyme in the blood. And the way they measure these enzymes is through what's known as a bioassay. And the units are units or international units per liter. That's just the units they use for expressing the concentration of enzymes in the body. If the liver enzyme, ALT liver enzyme level, exceeds 35 international units per liter, they know there is damage to the liver. Now, again, they don't know what's damaging the liver. The patient could have hepatitis. The patient could have cirrhosis of the liver. The patient could even have damage to the liver due to taking some other medication every day. Because a common side effect of taking drugs every day is they damage the liver. Why do you think that is? That's your detox center. We have learned that the liver is the organ that is responsible for breaking down or metabolizing most things. We've learned that it breaks down alcohol. Now, we have learned that when we say breaks it down, it doesn't turn it into nothing, but turns it into something else. But the liver is the organ that is breaking down, or at least converting, all these foreign substances, including drugs, in our body. And again, if you just take amoxicillin for a week, it's not going to cause any serious damage to your liver. But if you're taking any medication every single day for the rest of your life, almost every medication can damage the liver. So, yep.
For how long do these enzymes get released? Like how
For as long as the cells are being injured. Because it starts, whatever is injuring the organ, if it's a drug and you're taking it every day, it's continuing to damage those cells more and more every day you take them.
Let's say there's a heart attack, they have to test
The heart attack, then it's a sudden release of that enzyme, and then it drops off. In fact, since you're asking about the heart attack, let's just show you an image. Take a look at page, in the case of a heart attack, let's look at page. Yeah, page 185. 185. And on page 185, 185. So on 185, we are talking about, and here I highlighted it, leakage of myocardial enzymes into the bloodstream from infarcted tissue. Infarcted means dead or damaged tissue. So if you look in this graph right here on the left, this is the changes in these enzyme levels in the blood. Can you see what happens? And this is over the course of, what's the x-axis? In days. Can you see that? So over several days, immediately following that heart attack, can you see how the CPK enzyme level rises? So do some of these other enzymes. So they commonly monitor these. The higher the enzyme level rises is an indication of the severity of the heart attack. All right? And then the levels drop. All right? Now, that's where there was just a sudden injury from a, quote, heart attack, which we'll learn more about. But if there was recurring injury, let's say somebody has an infection of the liver, hepatitis, and every day it's damaging more and more liver cells, then the enzymes, in this case being released from the liver, continue to be released every single day. So the liver, enzyme levels stay elevated because it's continuing to damage, cause further damage. Same thing would be true for any medication that's damaging the liver, because it continues to damage it more and more every day. Now, I said that almost every medication can damage the liver if you take it frequently enough. In fact, if anybody has a bottle of Tylenol, the very first warning on Tylenol is, anybody know? Liver damage, all right? Tylenol is about as harmless of a medication as anybody takes, but if you were taking Tylenol multiple times a day, every day, month after month, it can damage the liver, even something as, quote, relatively innocuous or harmless as Tylenol. Okay, so let's go back to, all right, so we've talked about this chart. You can see that they have other enzymes they can monitor. In fact, there are many, many more enzymes than I've listed here. Let's return back to page 1. So on page 1, on the bottom paragraph, for this hypothetical patient, on the bottom paragraph, you will be monitoring the patient's ALT, liver enzyme level, and CPK, muscle enzyme level, in their bloodstream over the 10-week treatment period that they're taking their Lipitor. So now, before we go any further, let's all now look at this handout that we gave you. Okay, so I'll just make a brief comment about the marketing of drugs, how they market drugs. 30 years ago, the way they marketed prescription drugs, drugs that are prescribed by a doctor or dentist, is they marketed them in professional journals. So the drug, if Lipitor would be advertised, drugs like Lipitor or any other prescription drug, they would have ads in the New England Journal of Medicine, in the Journal of the American Medical Association, in the dental journals, because they were trying to market the drug to the prescribers, so the prescribers would start to prescribe those medications. About over the last 20 years or so, a whole marketing thing changed. They started marketing even prescription drugs to consumers. So now you will see advertisements for prescription drugs in lay publications, not professional journals, and even ads to the consumer on television. How many of you have seen on TV ads for Lunesta or some of these other medications? And they would never advertise to a consumer, to a lay person, for a prescription drug in the years past. Now they say that, you know, you can take this drug for depression or whatever it is, ask your doctor. Isn't that what they say? Ask your doctor. So they're encouraging now patients to go and visit their doctor and say, I saw this advertised on TV, I want it. This is a totally new approach. They never used to do that. The assumption was a lay person doesn't understand anything about this stuff, and just because they want something, you don't give it to them. But they've kind of changed the whole mentality. So this actually is an ad for Lipitor. you can see. And this appeared, I think, in Newsweek or Time Magazine. I've seen ads in Good Housekeeping and Redbook, you know, for drugs. So this is the side that says basically it's for the consumer. And it's showing, here's a guy, same guy, and he's got he weighs 182 pounds. He works out 3 times a week. He eats 2 apples a day. This guy, though, on the left, has a cholesterol level of 256 milligrams percent. And if he takes Lipitor, it's 150. All right? In other words, first of all, what is the cholesterol level supposed to be? Less than 200, right? We've learned that. You need to know that. Cholesterol level should be less than 200 milligrams percent, or milligrams per 100 milliliters of blood. So the point is, there are people where they eat right, they exercise, and they still have higher than normal cholesterol. You'd say, why is that? They chose their parents poorly. Because a lot of what we are, and a lot of the way our body works, is genetic. All right, and some people eat right and exercise, and because of genetic factors, they still have high cholesterol levels. And there are other people who do everything wrong. They eat all the wrong foods, right? They smoke, they drink lots of alcohol, not occasional alcohol. They never exercise, and they've got low cholesterol. They chose their parents wisely, all right? In other words, they just lucked out and have good genetics. So the point they're trying to make is, obviously, certainly, there's many people who don't eat right and don't exercise who have high cholesterol, and they need Lipitor, but even some people who do everything right may need Lipitor. Now, you'll notice I underlined some of the comments they make in this advertisement targeted for the consumer. They wrote, Lipitor is not for everyone, including those with liver problems, because they're going to take this medication every single day, and it tends to damage the liver. So if you start out with liver problems, they're telling you this is not for you. Also, they wrote, if you take Lipitor, tell your doctor about any unusual muscle pain or weakness. So this medication can damage muscle, specifically skeletal muscle. Now, this is the part that was targeted at the consumer. Some of you have seen in magazines, they'll have ads for a drug, and on the back side is all the fine print. Has anybody ever seen that? This is what you as a future healthcare professional need to know. This is not for the consumer because they don't understand this, but this is for you. So let's take a look at some of this information. I'm not going to go through this whole thing, but we are going to learn some of this. All right. Now, at the very top, right at the top, the manufacturer of Lipitor is informing this is not really for a layperson because they're not going to read this. It's informing the healthcare professional. Whether it's the doctor or the nurse or the pharmacist, they need to understand this. So, what is a contraindication? An indication is when you give a drug. A contraindication is when you don't give the drug. So when are they saying you don't give the drug? What does it say? Active liver disease. So if anybody has liver disease, you do not give them Lipitor. If you give them Lipitor, all the liability is on the prescriber because the manufacturer is saying, we advise you not to give this drug if anybody has liver problems. So if you give it as a prescriber, as a doctor, if a pharmacist dispenses it or whatever, a nurse administers it, this is against what the manufacturer says to do. All right, now, the warnings. The very first warning, and obviously it gives all kinds of other information. The very first warning is what? Liver dysfunction. They're very worried about how this drug might affect the liver. You'll notice they refer to Lipitor as an HMG coenzyme A reductase inhibitor. Again, I'm not asking you to know that term, but we have learned it is an enzyme inhibitor. It inhibits an enzyme in the liver, that's the name of it, that converts saturated fats into cholesterol. Now, just to the right of where I hand wrote ALT, And you'd say, what's ALT? That's the liver enzyme. So what did I underline? What I underlined here is it says, oops, highlighted the wrong one. All right, so what I highlighted here and underlined is, it is recommended that liver function tests be performed prior to and at 12 weeks following both the initiation of therapy and any elevation of dose. So you might say, what's a liver function test? Testing for that liver enzyme level. That's what a liver function test is. They want you to test that enzyme level and make sure that it's within the normal range. Because they're basically saying, if that enzyme level is elevated, you take them off that drug. You don't either you don't start them on the drug, or if they are started, you take it off.
Looks for multiple enzymes, right?
Huh?
Looks for all different types of enzymes.
Well, the main one is this ALT, because that's the liver enzyme. That's a liver function test. Now, just imagine the following scenario. Imagine a doctor's been prescribing Lipitor to a patient, and they've been on it for a year, a couple of years. The doctor runs these tests, checks the cholesterol level in the patient's blood, checks the liver enzyme level, and the doctor says, you know, I got some good news and bad news for you. And incidentally, you're always supposed to ask for the bad news first, so it ends with the good news. But let's say the patient says, oh, okay, what's the news? Well, the good news is, you know, you're taking that Lipitor that we've been having you take, it's really lowered your cholesterol level. It looks fantastic, it looks great. Oh, the guy's smiling, that's great. What's the bad news? You're going to need a liver transplant or you'll be dead in 6 months. In other words, the side effect of taking the medication may have damaged their liver to the point where their liver is dying. Now, let me remind you that all of you who go into a complete a healthcare clinical program will take an oath at the end. And the oath is basically, in medical schools, it's called the Hippocratic Oath, and they have something very similar in nursing and every other clinical field. What the oath is an oath, not that you will cure everybody. In fact, it has nothing to do with saying that you'll cure anybody. It's an oath you will not harm anybody. That's the oath you take. You can't promise that you're going to help people. You're going to try, but you promise not to harm them. That's why you cannot be sued if you don't help somebody, don't cure them. You can be sued for harming them. That's called malpractice. That's where this lawsuit comes in, malpractice, because you cannot harm anybody. So if you could say that this doctor, you know, I lowered your cholesterol. See, I made you better. Unfortunately, in giving you that medication, you're going to die because we damaged your liver. That you cannot do. So you might say, we're going to have to take you off the Lipitor. We're not going to be able to use it to lower your cholesterol, but we cannot risk damaging your liver. Yep.
Does the liver recover as a damaged permanent?
It depends how badly it's damaged.
And if you quit taking Lipitor, your cholesterol goes back up to
That's
where
correct.
it should be otherwise.
That's correct. But this is true with everything, you know, all medications. If you take medication every day for arthritis, it has other side effects, all right? And if you take medication for diabetes, but you cannot harm somebody, because if the process of trying to help them actually hurts them, then you're not doing them any favor.
Don't a lot of doctors and stuff get cash kickbacks from prescribing these
No,
drug companies?
no, they don't.
Are you sure about it?
Yeah, I am sure.
Thing that they
Well,
get
well, wait a second. Are you
to
asking me?
endorse
Are you
their
asking me? Are there unethical people in every profession?
No, I know there is.
All right.
It's not- it's
So
more
now
common.
you're suggesting that there's doctors are more unethical than most other professions. I don't accept that. Okay. It takes a lot of work to go through and become a physician,
Because when you
and it takes. Do you think most nurses are unethical?
No, but when
Why
you
not?
teach preventative, you need to
No,
get
I don't agree with you. I don't agree with you.
Let's talk about
I don't want to spend time on it because I disagree with you entirely. All right. Do you know of anybody who's a doctor?
No. not
Okay,
really.
why don't you find somebody who's a doctor? Does anybody know people who are doctors, either relatives or friends? Do you think they're unethical? No. I don't think so. Are there unethical doctors? Yes, Michael Jackson's doctor. all right, and he's in jail. But that's not most doctors. Most doctors work very, very hard. If you have to ask the question, this is the fundamental question. Did you become a doctor to make money, or did you become a doctor to help people? Most people go through all these courses, including you, because you want to help people, not because you want to make money. If you can make money in the process, great. But that's not the driving factor. If that is the driving factor, then you're going to be one of the unethical ones. But that's not why most people go into this medical
No,
field.
I don't say.
All right? So that's not what's causing them to do it. Yeah.
If, so if you get taken off of Lipitor because, you know, you have one of these liver problems, so the only real choice you have is diet then, right?
Yeah, there are other medications they can try. And what they're going to do is, if this medication won't work, they may try one of the other statins because maybe you'll tolerate one of the other statins better than this one. And there's other alternatives that are not even statins. But it is the responsibility of the doctor to be monitoring. That's the main point of all this. They can't just go and say, take the medication and don't bother coming back to see me again.
about these people that have high blood pressure, liver problems, all these ailments, and they take all these different drugs.
The doctors are responsible for understanding that. That's called drug-drug interaction as well.
Yes, about Dr. Murray's Michael Jackson's doctor.
Well, let's not talk about that right now. We'll do that during the break. All right, I want to stay focused on this. All right, now, just to the right of CPK. So CPK is the muscle enzyme. And so here's what it says. And this is the information from the manufacturer. Uncomplicated myalgia. What's myalgia? Muscle pain. Uncomplicated muscle pain has been reported in atorvastatin-treated patients. Myopathy, defined as muscle aches or muscle weakness in conjunction with an increase in creatine phosphokinase, or CPK values, should be considered in any patient with diffuse myalgias, muscle tenderness or weakness, and or marked elevation of CPK. Patients should be advised to report promptly unexplained muscle pain, tenderness, or weakness, particularly if accompanied by malaise or fever. All right, so in other words, this is the other warning, the other big warning. Not only do you have to monitor the liver enzyme level to make sure it's not damaging the liver, you have to monitor this muscle enzyme level to make sure it's not damaging skeletal muscle. Now, not only do the doctors need to be aware of this, of course, so do pharmacists. So anytime you've picked up a medication, the pharmacists are supposed to explain to the consumer, the patient, you should be aware this medication may cause injury to your muscles and cause pain. If that happens, contact your doctor. The problem is, not only do doctors fail to inform the patient, so do the pharmacists. How many times, we've mentioned this before, have you picked up a new prescription from the pharmacy, right? They hand you a bag with the medication in it, and with about 10 pages of paper, right? It looks like this, right? Nobody can understand it. And they say, do you have any questions? Right? Isn't that what they say? And then sign here. Meaning they have basically provided you with the information. So as you know, I'm a strong advocate in that people in the healthcare field be able to speak to their patients, explain to their patients their problem, and explain the medication. Because if they don't, they are not educating their patient, they are not warning them of the adverse effects. Just imagine how many people might be taking a drug like Lipitor who are experiencing muscle pain and thinking, I must be getting old. And maybe it's really has nothing to do with them getting old. It may be that that medication is damaging their muscle.
I don't know, like, how do you know which one works faster? Like, let's say, for example, Lipitor, if you're taking Lipitor and your cholesterol is going down, but you're not having any kidney problems after a certain amount of time.
Because they're supposed to check you periodically. It doesn't matter which one goes down or up faster. They're supposed to ask you to come in every so many months to recheck these values. They want to make sure, is it lowering your cholesterol or not? And is it causing a rise in the liver enzyme or muscle enzyme level? So that's why they ask you to come in. Again, when you take amoxicillin for 7 days, they don't have to ask you to come back in. You're done taking it in a week. But this is something somebody's going to take every day for the rest of their life. And they need to check you periodically. And it's not just a matter of, you know, let me get another office visit in. Okay, they need to monitor you. Otherwise, we don't know what the medication's doing. So, one last thing here, related to what I just said. Information for the patients. Patients should be advised to report promptly unexplained muscle pain, tenderness, or weakness, particularly if accompanied by malaise or fever. So the manufacturer of Lipitor is telling the prescriber of the drug, the doctor, and the dispenser of the drug, the pharmacist, advise your patient about this. Don't just not tell them anything. They need to know about this so they can report to you if there's a problem. Now, I will agree that they're not doing a good job in that. I don't think there's any malice, any evil, any conspiracy in terms of any of this. They're just not. They're too busy. They're busy people, and they're not taking the time to explain because too many people in the healthcare field are not good at explaining things. That's why I have you do essay questions to learn how to explain stuff. Yeah.
Because they generally think that most people won't have these side effects.
No, it doesn't matter whether they will or won't. The manufacturer is saying you must inform them. This is creating a liability issue. Because then, if anything that does go wrong, they'll say, you never told me that muscle pain was a symptom of a problem. But anyhow, whether they report muscle pain or not, they need to be testing the muscle enzyme level. Because that's actually more sensitive than whether they might have elevated muscle enzyme levels even before they start to notice any pain. So it's already damaging the muscle.
Could you define uncomplicated in this context?
Well, in other words, again, just there's nothing else that suggests other types of muscle problems. If somebody also happens to have rheumatoid arthritis, or they've got fibromyalgia, so then it's going to be difficult to distinguish between whether it's muscle pain due to the drug. But of course, the doctor would be able to discern that. Because again, they will have a baseline. They measure these levels before you begin the medication, and they measure them again once you are taking it. So if the level of the CPK enzyme level has risen between when you began and after you've been using it, then they would attribute it to the drug.
But how would a patient know if he's got
Well,
heart muscle problem?
we're not asking the patient to define it. We just want the patient to be aware of some of the signs that it could be causing a problem. But whether or not, as I said, they notice a problem or not, they're going to be asked to come into the office periodically, and they're going to run blood tests on them. Okay, so let's see what you're actually going to be doing. On page 3, you're going to be following these directions. This is page 3. So this is, all that I tried to do is I took this concept of spectrophotometry, which you would learn about in any physiology class, and I tried to create a lab exercise involving this concept in a very clinical way. All right? Because this is exactly what happens all the time. So blood samples were obtained each week for 10 weeks from a patient who's taking this drug. Now, I might just tell you they don't usually take a blood sample every week. But they would take it before they begin. They would take it after maybe 6 weeks into it, maybe 12 weeks. All right, but we just wanted to have it more frequent. All right, and the plasma cholesterol levels are determined for each blood sample each week using a spectrophotometer. Now, a doctor is not going to go and do the calculations. Yeah, they're going to get the numbers back from the clinical lab. But I want you to understand what the clinical lab had to do. Somebody had to go and figure this out, of what the cholesterol levels and the liver enzyme levels were. And so by understanding what's going on in the lab, you have a better appreciation of, you take the blood sample, you send it to the lab, and they send back all the numbers. And you have to appreciate, how did they get all those numbers? How do they determine that? So right below this chart, we wrote, prepare a standards graph using the blank and the standard solutions to show the relationship between the cholesterol concentration plotted on the x-axis and the light absorbance plotted on the y-axis. So in other words, you're going to take this data, concentration on the x-axis and light absorbance on the y-axis, and create a standard graph. This is exactly what I showed you earlier today on the spectrophotometer handout where we showed you with known sugar solutions, this was the concentration of glucose, this is the light absorbance, and you construct a graph that shows the linear relationship between the glucose concentration and the light absorbance. Once you've created the standard graph, then you can determine the unknowns, the blood samples. So, then we wrote, back on page 3 of your Lipitor handout, we wrote, using the standard graph prepared in number 4, complete the chart on the next page by determining the plasma cholesterol concentration for each week of the treatment with atorvastatin. You'd say, what does that mean? Look on the next page, page 4. So on page 4, these are the light absorbances that were measured using a spectrophotometer device in the clinical lab, and you're going to convert that into what the cholesterol concentration was week by week using that graph you just created. Right? So these are the unknowns. These are the unknowns, and you're going to basically determine, is the Lipitor that the patient is taking every single day, is it lowering their cholesterol level? Because that's the whole goal. That's why they're taking it. Now, back on the previous page, page 3, after you've completed that chart, number 6, construct another graph. This is a second graph that shows how the plasma cholesterol concentration plotted on the y-axis changed week by week plotted on the x-axis. Now again, I'm telling you exactly how to lay out the graph. I'm telling you what's on the x-axis and what's on the y-axis. All right, so we want to know, how did the cholesterol level change week by week? In other words, on page 4, this is on the x-axis, this is on the y-axis. It says that right in the instructions. Now, again, on the bottom of page 3, we want to remind you, the normal values for cholesterol are between 130 to 200 milligrams of cholesterol per 100 milliliters of blood. So the goal was to get that patient within that normal range. All right? If the cholesterol level is higher than this acceptable range, higher than 200, then you may have to increase the dose of Lipitor or change it to a different drug. All right, so you've got the whole reason for putting them on a cholesterol-lowering drug is to lower their cholesterol. Is it doing it or not? Have you ever taken a drug or know of somebody who was prescribed a drug and it wasn't doing the job and they had to switch and try them on a different drug? All right, that's what they're supposed to do. And you go to a doctor, if it's not solving the problem, whatever they're doing, they got to come up with another solution.
So you said there are other statin drugs. So is Lipitor the most prescribed because it's the most effective, or are they just really good at advertising?
Well, first of all, every manufacturer, I don't want to get into all the drug stuff because I teach a course in pharmacology. All developers of drugs have 20-year patent rights to be the exclusive manufacturer. Lipitor just lost that. Their 20 years are up. There is now CVS brand generic. All right? So you can now get CVS generic atorvastatin at a much, much lower cost. It was one of the earliest ones developed. Usually the drugs that are most best known are the ones that were among the first drugs to be created in that category. So this is true with everything. Adrenaline. Adrenaline is a registered brand name of epinephrine. There are many brands of epinephrine. How come the only one you've heard of is adrenaline? Because that was the very first brand. The very first manufacturer of aspirin was Bayer Aspirin of Germany. That's why everybody's heard of Bayer Aspirin. There's lots of brands of aspirin. They were the first manufacturer. So this was one of the first drugs in this category to be introduced. So that's why it's been around a long time. And their patent has run out. So there's a lot going on. Yeah, marketing is an issue. Marketing does count, but it's not the only issue. Because a medication has to be effective, the term they use is efficacious, and it has to be relatively safe. If a drug isn't safe, they pull it. The FDA will pull it. It will no longer be allowed to be sold. And if a drug isn't as effective, it will not continue to be as popular among the prescribers. All right, the idea is, I assume you're like me. If you're going to a doctor, you try to go to a good one. And if you've been to that doctor and they don't solve your problems very well or very frequently, you go change doctors. And so a good doctor is somebody who really knows their stuff and keeps up with the new information. And that's your job as a future healthcare professional. Whether you're a nurse or a dental hygienist, an occupational therapist, or whatever, your professional responsibility is to keep up with your field, be on top of it, and do the best damn job you can. And that's the only thing that really matters. Okay? Incidentally, that's my responsibility too. I have to keep up in my field of physiology and do the best job I can. All right? And there's people who are teachers. Some teachers are better than other teachers. Just like doctors are better than other doctors, and nurses are better than other nurses. You want to go to the one who you feel does the best job and is most up-to-date and keeps up with their stuff. Okay? That's how it works. Okay? If you hire a plumber, you want the best plumber you can get. Okay? At least not too expensive, but you want them to do a good job. You don't want them to flood your house. All right, now, we've learned that not only do you have to be worried about the therapeutic benefit, but also the adverse effects. So, we wrote that they are going to monitor the liver enzyme level in this patient. So each of those 10 weeks that they're going to draw blood from the patient, now they're not only going to check the cholesterol levels, they're going to check the liver enzyme and the muscle enzyme levels. So we wrote on page 5 to prepare a graph using the blanket standard solutions that were shown on the previous page to show the relationship between the liver enzyme level plotted on the x-axis and the light absorbance plotted on the y-axis. Again, you have to construct a graph showing the relationship between the liver enzyme level and the light absorbance. Then, using that information, you're going to complete this chart right here. Here's the light absorbance for the liver enzyme levels, and you're going to read these off the graph and convert that into what the liver enzyme level was. Now, we want to remind you that back on page 2, we indicated the normal range for the liver enzyme level. So if as you're determining these liver enzyme levels, it starts to exceed 35 international units per liter, that would be the point where you start to pull them off that medication. Because now we know it's starting to cause damage to the liver. Because if it started out where the liver enzyme level was within the normal range, and then you notice that they're on that medication and it's starting to go up, the assumption is what's making it go up is the drug. Especially if there's no other symptoms that they've got hepatitis or anything like that. All right, so then on page 6, you're going to do something similar for the muscle enzyme CPK. Now in this particular case, we've given you a little equation to use. It's not the preferred way. They usually prefer a graph, but this is a little formula just so I could throw this in, where you'll use this formula to convert these light absorbances into the muscle enzyme level CPK. And then, finally on page 7, the 5th graph is prepare a graph that shows both how the plasma cholesterol concentration plotted on the left y-axis and the liver enzyme level plotted on the right y-axis changed week by week plotted on the x-axis. Again, I've laid it out exactly what I want you to do. You might say, well, I don't even know what you just said. The weeks from 1 to 10 are on the x-axis. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The cholesterol concentration will be plotted on the left y-axis and the liver enzyme on the right y-axis, and you're actually going to have 2 graph lines right on the same graph. One of these graph lines will show cholesterol level changes over 10 weeks. The other will show the liver enzyme level changes over 10 weeks. So on one graph, we can visualize very quickly what's happened to the cholesterol level and what's happened to the liver enzyme level. The beauty of a graph is rather than looking at a column of numbers, we see a graphical image of basically, has it gone up, has it gone down? And that tells us immediately the trend of what's happening. Everything that I described is exactly what happens in real life in medicine. Now again, we're not saying that the doctor is doing these spectrophotometry. They're not sitting and putting the blood samples in a spectrophotometer, and they're not doing this graph. But they are getting the data back from the lab. And they may even ask to have it presented in a graphical form. So that's what the labs provide. If you've had blood tests done, you know that typical blood tests are $300 or $400. Isn't that right? So they could be more. They could be $600. They could be $1,000. These blood tests are expensive, right? Because they're measuring all these chemical levels in the blood or in the urine, and they don't just measure one or two, they measure lots of chemicals, and there's all, you know, you've got literally biochemists in there who also get paid pretty well, and they have to do all this stuff, and hopefully it's done accurately. Because if their data isn't good, if they're sloppy in their determining these things, then the data you get is junk. And the information that the medical people are using to make their diagnosis and make all their decisions is faulty. Incidentally, one of the other things that doctors have to be smart enough to recognize, if they don't feel that these numbers may be suspect, they need to reorder a new blood test. Has anybody ever had to do that? Where you had blood tests and they said, let's do it again. Because they just wanted to make sure that these were correct. Because sometimes mistakes are made. So you can't just say, well, this is what the lab shows, right? You got to say, you know what? Let's run it again. I want to double check. I want to make sure before we start treating you in a totally different way, right? Because let's say it showed elevated liver enzyme levels, and it's really not. So before they take you off that Lipitor, let's double check and really make sure those liver enzyme levels are elevated.